Soft tissue injuries. Usually caused by sudden wrenching movements, the joint overstretches, tearing the surrounding muscle or ligament. Minor fractures are commonly mistaken for sprains and strains. If you're not sure, you should treat the injury as though it were a fracture. The only way to rule out a fracture is by X-ray. In terms of a definition, sprain is an injury to the ligament around the joint, and a strain is an injury to the muscle or tendon. When we treat a soft tissue injury, we're going to follow the Ricer method. So rest the injury. Don't allow the sports player to carry on playing. It's better to take time out now than miss the next 10 matches. Apply ice. If you apply an ice pack as soon as possible, this will help reduce swelling, which will speed up recovery. Place a tea towel or triangular bandage between the skin and the ice pack to prevent frostbite, and always allow the skin to return to a normal temperature before reapplying the ice. Do this for 20 minutes every 2 hours for the first 24 hours for the maximum effect. Compression. Apply a firm, not constrictive bandage to the injured area. This helps to reduce swelling. The bandage can be applied over a crushed ice pack for the first 10 minutes or so. Check the casualty's circulation in their fingers or toes by gently pressing the nail. The nail should turn pink again within the next few seconds. Elevate the injury. This also reduces swelling and may provide comfort. And refer. Always encourage the casualty to seek medical aid to ensure there is no fracture or any further treatment required. Dislocations. A dislocation is where a bone becomes partially or fully dislodged at a joint, usually as a result of a wrenching movement or sudden muscular contraction. The most common dislocations are thumb or finger, kneecap, shoulder, and jaw. There may also be a fracture at or near the site of the dislocation and damage to the ligaments, tendons, and cartilage. It can be difficult to distinguish between a fracture and a dislocation, and in fact, the dislocation may have caused fractures. Never attempt to manipulate a dislocated joint back into place. This is a job for the experts. The procedure can be extremely painful for the casualty, and you may cause further and unnecessary damage. Signs and symptoms. Pain, difficult or impossible to move at the joint, deformity or abnormal mobility, swelling, discoloration, and bruising. Reassure the casualty. Tell them to keep still. Moving around will only cause more pain. Check the extremity for circulation by checking the colour of the skin. It should be natural, not grey or blue, and press the nail, making sure colour returns within a few seconds. If circulation is compromised, call 000 for an ambulance, as the dislocated bone is pressing on a vital blood vessel. Use soft padding to support the injured joint. Don't attempt to correct the dislocation, as this may cause further injury. Apply ice if the casualty is able to tolerate it. This will help reduce swelling. Elevate the injury if the casualty is able to tolerate a sling or the elevation of a lower limb. Be cautious to carefully support the injured joint and seek medical aid. Fractures. A fracture is a break in the continuity of the bone. Fractures can be extremely painful and can cause internal injuries and damage to other structures. There are 4 types of fractures we're going to look at. Closed fractures, and this is where the skin over the fracture remains intact. Open fractures, the skin over the fracture and the bone is broken, and the bone may protrude through the skin. A complicated fracture is where there's injury to major nerve, blood vessels, or vital organs. And a green stick fracture, most commonly found in children, is when the bone is partially broken, only to the halfway point. Signs and symptoms. Swelling, pain, bruising, redness, loss of function, deformity, lumps or depressions along the surface of the bone, pain at or near the site of injury. Sometimes the casualty will feel or hear the break occur. There might be a grinding sound on movement, unnatural movement, and tenderness. Rest and reassure the casualty. Tell them to keep nice and still. Movement will only cause more pain. Keep the injury still with your hands until it is properly immobilized. The casualty might be able to do this on their own. The injury should be stabilized using a splint. A limb should be immobilized above and below the fracture and the joint above and below. Don't move the casualty until the injury is immobilized unless they're in danger. Don't apply a sling to an injury if you have called an ambulance. Just keep them still and as comfortable as possible. Don't let the casualty eat or drink anything, they might need surgery. Treatment of an upper limb fracture. Carefully place the arm in a sling against the trunk of the body. With a lower arm fracture, generally they're placed in an arm sling against the trunk. Upper arm fractures in a collar and cuff sling, and a collarbone fracture, they're normally supported by an elevated sling, keeping the elbow down at the casualty's side when using an elevated sling for a collarbone. The casualty's clothing can be utilised as an improvised sling. If the casualty is in severe pain, circulation or nerves to the arm are affected, the casualty has breathing difficulties, or you're just unsure, call 000 for an ambulance. Treatment of a jaw fracture. Contact sports and assault may lead to jaw fractures. The casualty may have difficulty speaking or swallowing and have severe pain when attempting to bite down. It is important to consider that the casualty may also have dental injuries, head injuries, and swelling that might impact their airway. Sit the casualty down and have them support their chin if they're able to. Keep the casualty warm and still and monitor for decrease in levels of consciousness. Call 000 for an ambulance. Treatment of a lower limb fracture. Keep the casualty warm and still and dial 000 for an ambulance. It can be very difficult to move the casualty around when they do have a leg fracture. Check the colour and warmth of the foot for adequate circulation. If the ambulance arrival will be delayed, carefully adjust the position of the limb if necessary and immobilise the injury by bandaging the sound leg to the injured one and padding in between. The ambulance officers on the phone will give you some guidance here. Check circulation beyond the injury and any bandages, and loosen any bandages if they become too tight.